As many of you know, we are heavily involved in research activities with regard to what we call cardioprotection, and also which is under that big name of anti-aging. Anti-aging is not really a scientific term, and I personally don't like it. Many people call it age management, but there's something to it, and we have more tools in our hands now than we had years before to protect ourselves and to counteract basically the process of senescence or aging or degeneration of cells in our bodies. So just look, what was the lifespan in 1900? It was 30 years worldwide. In the 1950s, it was 42 years. Nowadays, the worldwide lifespan is 72 years of age. Women in Japan live up to 84 years nowadays. So there's regional differences. So obviously, whatever we are doing in medical research does change the lifespan, and we are very active with regard to looking at different ways how we can prevent aging processes, maybe not prevent, but at least delay, in order to delay also the onset of what we call age-related chronic diseases, whether it's degenerative diseases of our joints, knee pain, arthritis, heart failure, strokes, atherosclerosis, you name it. So there's a lot of going on right now with regard to the research on a molecule which is called NAD. And NAD stands for nicotine amide adenine dinucleotide. That sounds fancy, but it's a very simple, what we call a coenzyme. It's a hydrogen carrier which plays a role as a catalysator, if you wish, in several metabolic reactions. It's a helper molecule, if you wish, and its main effect is in repairing damages of the DNA. There's a role in gene expression, and also it maintains the mitochondrial function. The mitochondria are the energy elements within our cells. And we know for many, many years now that, for example, in aging hearts, there's decreased levels of NAD detected. And this is associated with thickening of the heart muscles. We call that left ventricular hypertrophy, fibrosis or scar formation, an increase in the damage of DNA and mitochondria, a shortening of the telomere length, and an accumulation of what we call aging metabolites. So several basic research studies, especially in experimental animals, have shown that NAD therapy is beneficial. If we give NAD exogenously, intravenously, for example, we can increase cognitive function, we can improve metabolism in experimental animals, we can increase energy levels, even athletic performance, and it plays a role in weight management. So all this is a basis for what we call now NAD IV infusion therapy in humans. Clinical studies are sparse, but we have very interesting and very promising early results.
Together with the clinical research team of Dr. Ernst von Schwarz, we provide infusion therapy, including NAD, which we believe it helps benefits with anti-aging, it aids with autoimmune diseases, helps increase energy performance, and fight against addiction recovery.